Hi there, it's Dr. Hart again, and I have some really good test questions. These are on the bladder, bowel, and perioperative. These are fundamental concepts. These are actual ATI questions. So I'll go through the questions, I'll give you the answer, and then we'll talk about the why the other answer choices are not correct and the rationales. So there's like 13 of them, so it might take a little bit to get through these. So let's get started. Okay, here's the first one. Which should the nurse do before collecting a stool sample for occult blood? Okay, so, and I think I had a previous question on occult blood, which is a Guaiac test. Guaiac test will test for blood hidden in the stool. That's what occult blood means, hidden, something that's hidden in the stool. We're looking for blood in the stool, okay? Okay, so here are the answer choices. Plan to collect the first specimen of the day. B, obtain a sterile specimen container. C, wash the client's perineal area. And D, ask the client to void. Okay, the key word here in this test question is the word before. That's why I highlighted it. Okay, so I'll give you a couple of minutes to think about the answer choice and answer choices, and then we'll come back, go over the answer and the rationales. All right, let me take a minute to state that I have a YouTube channel, Nursing with Hart, PhD. If you're getting something out of these test questions, if they're helping you with this content, this is fundamentals content, and I also cover mental health content because that's my specialty. I've been a nurse for about over 10 years now, and about 8 of those years, six years were in practice and working in various detox centers, mental health centers, treatment centers. And the last 5 years was in nursing education. Okay, so let's go back to this test question. What should the nurse do before collecting a stool sample for occult blood? All right, and the correct answer is D, ask the client to void. Okay, and the reason why you're going to have the client void is to empty the bladder of urine before trying to get a bowel sample, okay, is to prevent an accidental contamination of the specimen by the urine. So you're going to have the client void, empty their bladder before you attempt to collect a stool sample. Okay, so that there is urine that's mixed in with the stool sample, and that will contaminate the sample. All right, let's go back to the other answer choices that are incorrect. Letter A, plan to collect the first specimen of the day. So this is incorrect. Collecting the first specimen of the day is unnecessary for this test. Letter B, obtain a sterile specimen container. That is also incorrect. Using a sterile specimen container is unnecessary. This is medical, not surgical. Asepsis should be followed. Okay, the bowel system is not sterile, so this is not a sterile procedure. Letter C, wash the client's perineal area. Washing the perineal area, this is also incorrect. Washing the perineal area is unnecessary. The nurse may assist the client to perform perineal hygiene after the stool sample is obtained, okay, but not before. Okay, so that's the answer and rationales on the first question. Next question, a nurse is preparing to administer a cleansing enema to a client. Which of the following actions should the nurse take? Okay, let's read through the answer choices. A, this is a skill that should be covered in the fundamentals of nursing. Okay, administering an enema, cleansing enema. Okay, first answer choice, letter A, keep the container of solution at a level to maintain client comfort. B, hold the container of solution 30 centimeters or 12 inches above the anus. Letter C, hold the container of solution level with the client's upper hip. Or D, hold the container of solution 15 centimeters or 6 inches above the anus, and then lower it 15 centimeters below the anus. Okay, and the correct answer is letter B, hold the container of solution 30 centimeters or 12 inches above the anus. When administering a cleansing enema, to allow for a continuous slow installation of solution to promote evacuation of feces in the bowel. So this is a patient who is constipated, or for whatever reason the doctor has ordered a cleansing enema. With the cleansing of the enema in this procedure, you're using gravity to your advantage. So you're going to hold the container of the solution 30 to 45 centimeters or 12 to 18 inches above the anus in order to use gravity to instill the solution into the bowel. Okay, so let's look at the other answer choices. Letter A, keep the container of solution at a level to maintain client comfort. So that one is incorrect. The height of the container of solution is determined by the type of enema being administered, which would be facility policy. The client's comfort level is not a criteria that is used when giving a cleansing enema. Okay, and letter C, let's look at why that is incorrect. Letter C, hold the container of solution level with the client's upper hip. Again, the height of the container of solution is determined by the type of enema being administered. The height of the client's upper hip is not the criteria that is used when administering a cleansing enema. And letter D is also incorrect. Hold the container of solution 15 centimeters or 6 inches above the anus, then lower it 15 centimeters below the anus. This is not the appropriate height of the container of solution when administering a cleansing enema. The container is not lowered below the anus during the procedure, because that would actually stop the procedure if you lower it below the level of the anus. And we want the solution to continue flowing into the bowel. So the correct answer on this one is letter B. Okay, next question. A nurse is preparing to administer a soap suds enema to an adult client. Which of the following actions should the nurse take? Okay, and so these are priority. What you have to know this procedure again also, and what is the actions that the nurse should take. Letter A, put on sterile gloves. B, assist the client to the left Sims position. C, hang the enema container 60 centimeters, 24 inches above the anus. Or D, insert the tubing about 15 centimeters or 6 inches into the anus. All right, I'll give you a minute to think about these answer choices. Okay, we're back. So the correct answer is letter B, assist the client to the left Sims position. This position makes it easier for the enema solution to flow by gravity into the sigmoid and descending colon. The nurse should also have the client's right leg flexed to facilitate insertion. Okay, So the client would be turned to the left side. Sims position would be where the right leg is pulled up so that the colon is in the right position for the insertion of the solution. Okay, letter A, put on sterile gloves. Sterile gloves are not necessary. This is a clean or medical asepsis procedure. It's not a sterile procedure. Letter C, hang the enema container 60 centimeters or 24 inches above the anus. That's incorrect. The height of the fluid affects the speed of installation, so the maximum recommended height is 45 centimeters or 18 inches. And letter D, insert the tubing about 15 centimeters or 6 inches into the anus. Okay, letter D is also incorrect. The maximum length of insertion is 10 centimeters or 4 inches. Okay, so here's some more information. The nurse would adjust the bed to a comfortable working height, position the patient on their left side, Sims position, with the upper thigh pulled toward the abdomen if possible, making sure that your patient is comfortable and not in any pain from this position, or knee chest position as dictated by the patient's comfort and condition. Fold the top linen back just enough to allow access to the patient's rectal area. Drape the patient with a bath blanket as necessary to maintain privacy and warmth. Place a waterproof pad under the patient's hips. Okay, next one. Which of the nurse's immediate priorities when a patient enters the Post-Anesthesia Care Unit or PACU? Select all that apply. Okay, so Post-Anesthesia Care Unit. This is after surgery, post-op. So you have to know, as part of your fundamentals course, you should be learning about this. Okay, what are the most important? Patient education before surgery. And what are the assessments that should be done before and after surgery? All right, so let's read the answer choices. Apply a pulse oximeter. Letter B, apply an electrocardiogram or EKG monitor. C, apply a blood pressure monitor. D, observe patient outputs. And E, observe respiration rate. Okay, so these are immediate priorities after surgery. Okay, I'll give you a minute to think about these and then we'll go over the answer choices and which ones are correct. This is a select all that applies, so don't forget. Any of these can be correct. It can be one answer, 2, 3, 4, or all 5. Okay, we're back. And so the correct answers are A, B, C, and E. Okay, letter A, apply a pulse oximeter. This is correct. Upon a patient's entrance to the PACU, the immediate priority is to maintain a patent airway and verify respiratory and cardiac function. So we're always thinking ABCs. Airway, breathing, circulation, and those should be under control at all times, even pre-op, during surgery, and post-op. Okay, this requires immediate application and observation of a pulse oximeter. Letter B is also correct. Apply an EKG monitor. In the PACU, the immediate priority, again, is to maintain the patient airway, verify the patient's respiratory and cardiac function. This requires an immediate application and observation of an EKG monitor. All right, letter C is also correct. In the PACU, the immediate priority is to maintain a patent airway and verify respiratory and cardiac function. This requires immediate application and observation of a blood pressure monitor. Okay, letter D is incorrect. Observing patient outputs might be part of the patient's post-op care plan, but this is not the nursing priority in the PACU. And letter E is also correct. In the PACU, the immediate priority is to maintain a patent airway and verify respiratory and cardiac function. This requires immediate assessment of respiratory rate, depth, and characteristics. Okay, do you see a pattern here? Okay, maintaining a patent airway, verify respiratory and cardiac function. Okay, with the respiratory status, the nurse assesses respiratory function by monitoring respiratory rate, rhythm, and depth, auscultating breath sounds, noting the oxygen saturation level, PCO2 levels, assessing skin color, observing cardiovascular and mental status. Okay, the nurse assesses cardiac, cardiovascular status by taking vital signs, monitoring the EKG, rate and rhythm, and observing skin color and condition. All right, next question. A client is admitted to the Post-Anesthesia Care Unit. Which nursing action is most important during the client's stay in the unit? So again, always thinking as you're looking at these answer choices, we're looking at priority, what's most important for the nurse. What is the nurse's action that's most important during the client's stay when they're admitted to a post-anesthesia care unit or PACU. Think about ABCs when you're looking at these answer choices. ABCs, and I bet you can figure out which one it is. Okay, but if you get this test question, you're not going to have me letting you know or giving you clues. You have to figure this out on your own. So just always, always, always when you're answering these test questions, think about ABC. Maslow's hierarchy of needs. Think about safety. Okay, and that will help you to answer these questions. All right, we'll give you a minute to think about what might be the correct answer. Okay, let's come back and look at these answer choices. Answer choices are monitoring. A, monitoring urinary output. Think of priorities. Okay. B, sorry. B, assessing level of consciousness. C, ensuring patency of drainage tubes. And D, suctioning mucus from respiratory passages. Okay, and the correct answer is letter D, suctioning mucus from respiratory passages. Okay. Maintaining a patent airway always is the priority to prevent respiratory distress and hypoxia. This follows the ABCs, airway, breathing, circulation of client care. Let's take a look at the other answer choices and why they're incorrect. Letter A, monitoring urinary output. Although monitoring of the urinary output is conducted to ensure that urinary functioning is maintained, it is not the priority when you're looking at these other answer choices. Letter B, assessing level of consciousness is part of the routine assessment of a client recovering from anesthesia, particularly conscious sedation and general anesthesia, but it is not the priority. Letter C, ensuring patency of drainage tubes. Although tubes and equipment are always monitored and maintained, the patency of drainage tubes is not the priority. Okay, priority is suctioning. Okay, keeping the airway clear. Next question. An obese client has abdominal surgery for removal of the gallbladder. Which should the nurse be most concerned about if exhibited by the client? This is another ABC question. That's why I love these questions. If you're thinking about ABC at all times while you're answering these, you'll get it every time. Here are your answer choices, okay? So the nurse should be most concerned about what when the obese client has had abdominal surgery? Letter A, constipation. Letter B, urinary retention. C, shallow breathing. Or D, inability to provide self-care. All right, I'll give you a minute for this one. Okay, and we're back. The correct answer is letter C, shallow breathing. ABCs, we're concerned with the breathing, that's the priority, and the airway. After abdominal surgery, clients frequently have shallow respirations, okay, because of the anesthesia, most times. Because when the diaphragm contracts with a deep breath also, it increases the intra-abdominal pressure that can cause pain at the operative site. So this is someone who has an incision, okay, after surgery. They're going to have an abdominal incision of some type. It might be staples, it might be tape. And when they go to take a deep breath, it might hurt. So they might be having shallow breathing because of the pain. That's why it's important to take care of the pain and maintain it. Relieve the pain for your patient. Shallow breathing may result in atelectasis, hypostatic pneumonia, or both. Okay, so very important. Let's look at the other answer choices. Letter A, constipation. Constipation as a result of anesthesia is a concern, but it is not life-threatening. Okay, so especially if the client is on any morphine or opiates for the pain, they may become constipated. That's an expected side effect of the medication, not the priority. Okay, letter B, urinary retention. It may be a result of the anesthesia. It's a concern, but it's not life-threatening. Okay. And letter D, inability to provide self-care. Although a person may experience an impaired ability to provide self-care during recovery from surgery, it's not life-threatening. So that's why the nurse is there. That's why the patient care tech is there to help the patient after surgery to provide self-care. Here's some more information. During surgery, the cough reflex is suppressed. Mucus accumulates in the trunk, tracheobronchial passageways, and the lungs do not ventilate fully. After surgery, respirations often are less effective as a result of the anesthesia, pain medications, and decreased voluntary respiratory effort because of the incision or other pain. Patients who have thoracic or high abdominal incisions are especially prone to shallow breathing because of incisional pain with deeper respirations. As a result, alveoli do not inflate or may collapse and secretions are retained, increasing the risk for atelectasis and respiratory infection. Deep breathing exercises hyperventilate the alveoli and prevent them from collapsing again. Improve lung expansion and volume, help to expel anesthetic gases and mucus, and facilitate oxygenation of tissues. And deep breathing exercises is something that one of the many things that you're going to teach your patient before surgery, prior to surgery. Why? Because once the patient comes out of surgery, they may be groggy, they're in pain. This is not the time to educate them. They're not going to be able to comprehend. They're not going to be listening to your education. So education is required before surgery. Next question. Which is the most important assessment made by the nurse after ensuring a post-operative client has a patent airway? Okay, so in this case, we've taken care of the A for airway, okay? So consider ABCs, airway, breathing, circulation. Airway is taken care of. So what comes next? Let's look at the answer choices. Condition of the drains, letter A. Letter B, level of consciousness. C, stability of the vital signs. And D, location of the surgical dressing. We'll give you a minute to think about this one. Okay, and if you're following ABCs, you should have figured this one out. You've already taken care of making sure that the post-op client has a patent airway. So what else is left with ABCs? Breathing and circulation. So the correct answer is C, stability of the vital signs. Vital signs is what? Blood pressure, pulse, temperature, okay, respirations. So all of those things are checking the circulation of the blood, okay? Airway, breathing, circulation. So assessment in acute situations always follows the ABCs, airway, breathing, and circulation. Respirations and pulse reflect the cardiopulmonary status of the client. Let's look at the other answer choices. Condition of drains. Although condition of drains will be assessed, the physiological status of the client is the priority. Letter B, level of consciousness. I see students correct this, I see students choose this answer incorrectly so many times that level of consciousness is important and eventually will be assessed. It's not the priority. Okay, and letter D, location of the surgical dressing. Okay, both location and status of the dressing should be assessed, but not until more critical assessments are completed. Okay, immediate post-op assessment and care in the PACU involves assessing the post-op patient with an emphasis on preventing complications from anesthesia and/or surgery. Assessments are continuous using pre-op and intraoperative data as the basis for comparison. The assessments made in the PACU include respiratory status, airway pulse oximetry, cardiovascular status, which is blood pressure, temperature, central nervous system status, level of alertness, movement, shivering, fluid status, wound status, GI status, any nausea, vomiting, and general condition. These assessments initially are typically made every 10 to 15 minutes. Next question. A nurse is caring for several clients who receive general anesthesia. A client with which concurrent health problems poses the highest risk for the development of post-operative complication. Okay, so your client has received general anesthesia. They have other health problems. Which one of these health problems is going to pose the highest risk for the client developing a post-operative complication? All right, let's go through the answer choices. Gastroesophageal reflux disease, B, reduced reflexes, C, hypothyroidism, or D, emphysema. Okay, so again, this is another ABC question. If you're thinking about ABCs, you'll be able to pick out the right answer. All right, I'll give you a minute. Okay, and the correct answer is letter D, emphysema. Why do you think emphysema is the correct answer? Think about your ABCs. Respiratory problems complicate the administration of inhalation anesthesia. Emphysema is characterized by destruction of alveoli, loss of elastic recoil, and narrowing of the bronchioles, which result in alveolar hyperinflation and increased airflow resistance. Okay? Let's look at the other answer choices and why they are not correct. Gastroesophageal reflux disease, or GERD, is not a problem with general anesthesia. because of interventions such as keeping the patient NPO before surgery, use of a cuffed endotracheal tube, and positioning. Letter B is reduced reflexes. Although reduced reflexes are significant to know when monitoring a client throughout the surgical experience, they don't place a client at the greatest risk. Letter C is hypothyroidism. Although decreased metabolism is taken into consideration when monitoring reflexes during the induction, maintenance, and reversal phases of anesthesia, hypothyroidism does not place a client at the greatest risk. All right, next question. 8 hours after spinal surgery, a client has not voided. The client is restless and reports abdominal pain. What action would the nurse perform before administering pain medications? Okay, and remember when I said before on a previous test question, when you see these answer choices, you're not only thinking ABCs, they're also thinking about the nursing process. And if you see in the answer choices some type of nursing assessment, take a look at the nursing assessments a little bit closer, okay? There may be more than one answer choice which is an assessment, but take another look at those because assessments should come first in the nursing, or assessments come first in the nursing process. Okay, we'll give you a minute to look at these. Okay, and the correct answer is D. You're going to palpate the abdomen for a distended bladder. Okay, the client after spinal surgery has not, 8 hours after surgery, has not voided. Okay, so we're going to palpate the abdomen for distended bladder, which is an assessment. Okay, nurses can provide interventions to alter or relieve pain. A client has not voided for 8 hours after surgery. The client is restless and reports having abdominal pain. The nurse would assess for a distended bladder by palpating the lower abdomen. The client most likely has a distended bladder and needs to be catheterized to obtain relief. The client probably does not have peristalsis following surgery. Bowel movement is not expected after surgery. So the letter B is not correct. You would not check the database for the last bowel movement, okay? And you would not auscultate the abdomen for bowel signs if they haven't voided. A bowel movement is not expected this soon after surgery. A physical assessment would be performed before checking the database for the last bowel movement. And letter C, assess dressing for drainage. The dressing is on the spine. Think about this. They had spinal surgery. Where's the dressing? It's not going to be on the abdomen. It's going to be on the back, on the spine. The dressing is on the spine and not where the pain is located, which is the abdomen. Okay, so there's no need to assess the dressing. You would assess the dressing, but it's not the most urgent action. Next question, we have just a couple more here. A student is assessing a postoperative client who has developed pneumonia. The plan of care includes positioning the client in the Fowler's or semi-Fowler's position. What is the rationale for this position? Okay, so you should have in your skills lab, you should have learned about the different positions, Fowler's and semi-Fowler's, okay, and what the differences are. So again, the thinking about the airway, okay, and the breathing on this question. So let's look at the answer choices. Letter A, it increases blood flow to the heart. Letter B, the client will be more comfortable, have less pain. C, it facilitates nursing assessment of skin color and temperature. Or D, promotes full aeration of the lungs. Okay, and the correct answer is letter D. It promotes full aeration of the lungs. Pneumonia may occur in the post-op client from aspiration, immobilization, depressed cough reflex, infection, increased secretions from anesthesia, or dehydration. Nursing interventions include positioning the client in the Fowler's or semi-Fowler's position to promote full aeration of the lungs. The positioning does not allow for nursing assessment of skin color and temperature, as this can be achieved in the supine position. There is usually no pain associated with pneumonia, so suggesting the client will be more comfortable is inappropriate. The blood flow of the heart is not impacted by the Fowler or semi-Fowler's position, but rather sitting to standing position. Lung aeration, just to let you know, refers to the presence of air within the lungs or the process of air filling the tiny air sacs or alveoli to allow for gas exchange. That's what lung aeration is. Next question. A nurse is halfway through administering a tap water enema to a 42-year-old patient in preparation for surgical procedure. The patient complains of dizziness. What is the next action that the nurse should take? And so this is the skill of administering a tap water enema. This should be covered in your fundamental skills class. I like these test questions because you should not only know the content from your textbook, you should also know these procedures, because guess what? These procedures can easily be on your NCLEX. A lot of times they're drop downs, sometimes they're the new next gen type of question where you have to pick the order of the skill. Okay, so you have to know what these skills are. Okay, so your patient is you're conducting an enema on your patient and they're complaining of dizziness. So what is the next action for the nurse? So answer choices: A, complete the procedure. B, raise the head of the bed. C, instruct the patient to take deep breaths. Or D, stop the enema. And the correct answer is D. You must stop the enema. The patient may be experiencing a vagal response. The nurse should stop administering the enema. Letter A is incorrect. The nurse should not, B is incorrect. The nurse should not raise the head of the bed, but may have to lower the head of the bed because the patient may be going into shock. Letter C, instruct the patient to take deep breaths, is incorrect. This is not an appropriate action because it does not address the potential seriousness of a vagal response. Okay, letter D is correct. The nurse should stop administering the enema and perform additional patient assessments such as vital signs and repositioning. Just FYI, the vagal response or vasovagal response is an involuntary nervous system reaction when the vagus nerve overstimulates the parasympathetic nervous system. This causes a sudden drop in heart rate and blood pressure, which rapidly reduces blood flow to the brain, frequently leading to dizziness or fainting, which is considered a vasovagal syncope. Okay, next question. A nurse is providing care for a patient after abdominal surgery. Which interventions should the nurse include in the patient's plan of care to help prevent respiratory complications. This is a select all that apply again. Okay? Letter A, schedule for the patient to be turned every 4 to 6 hours. Letter B, encourage the patient to use the incentive spirometer. C, closely monitor the patient's oral fluid intake every shift. D, assist the patient in providing a sputum specimen for culture. And E, teach the patient to cough and deep breathe with a pillow splint. All right, I'll give you a minute for this one. Don't forget, select all that apply. Can be one of them, it can be two of them, three of them, four of them, or five. All five can be correct. Look at each answer choice and answer, is that answer correct? Treat each answer choice as a true or false. Okay, and correct answers on this ones are B, C, and E. B, C, and E. Okay, let's look at the other answer choices. A, schedule for the patient to be turned every 4 to 6 hours. Okay, so you have to look carefully at each answer choice. If you just read schedule the patient to be turned, oh yeah, that's a good one. No, it's not, because the timing is wrong. Patients who have had surgery or on bed rest must be turned every 2 hours to prevent respiratory complications and skin breakdown due to immobility. And the 2 hours wasn't just pulled out of somebody's hat. These are all based on research. Okay, so typically every 2 hours for turning schedules. Okay, letter B is correct. One way a nurse can encourage patients to take frequent deep breaths is through the use of incentive spirometer. Deep breathing will reopen alveoli and air sacs after an anesthetic. Okay, and if you're not sure, go back and review the procedure for teaching how to use the incentive spirometer. Letter C is correct. Closely monitor the patient's oral fluid intake every shift. This is correct. Increased oral intake will will liquefy secretions and promote expectoration. The patient's intake should be closely monitored during every shift. Letter D is incorrect. Unless there are symptoms of a respiratory infection, there's no need for the nurse to obtain a sputum specimen for culture. And letter E is correct. A nurse should encourage the patient with an abdominal or chest incision to hold a pillow against the incision while taking deep breaths and coughing. This action will prevent incisional pain, putting the pillow against the incision. Okay, here's some more information, okay, that should be covered in your fundamentals class in that chapter. You should know what to do if the patient has an abdominal incision, right? If they go to cough, that incision can split open, and that's called a wound dehiscence. A splitting incision or wound dehiscence can occur when a surgical cut reopens after being stitched or stapled. More information. An evisceration is the protrusion or removal of internal organs. This applies to highly distinct contexts. A severe medical emergency and a specialized ophthalmic surgery. So abdominal evisceration is considered a medical emergency. This is where the internal organs can accidentally pop out of that surgical incision. Nursing interventions, if this happens, do not try to push the organs back into the body. This may risk further internal damage and severe infection. The nurse should cover the exposed organs with a sterile, moist dressing and immediately notify the provider or surgeon because this patient will most likely have to go back into surgery to correct that incision. Okay, one last one. A patient has had abdominal laparoscopic surgery and now has nausea and vomiting after administration of morphine. What action should the nurse take next? And I see over and over and over again, I see students get this one wrong. Okay, this is the same. Think about a patient who is having a seizure. This is something that you would do for a patient having a seizure. Okay. Letter A, raise the head of the bed. B, turn the patient on their side. C, obtain an order for an anti-nausea medication. Or D, perform suction as needed. And I'll give you a minute on this one. Okay, you have a patient who's had abdominal laparoscopic surgery and now has nausea, vomiting after they were given morphine, which is a common reaction to morphine, okay? The correct answer is B, turn the patient on their side. Why would we do that? The nurse should turn the patient on the side to prevent aspiration. The patient is vomiting. You don't want them to aspirate the vomit back into the lungs. Okay, turn them on their side. Letter A is incorrect. The head of the bed may need to be raised, but it's not the next nursing action. Letter C is incorrect. Once the patient has been successfully repositioned on their side, the nurse then can obtain an order for an antiemetic, okay, or anti-nausea medication. Letter D is incorrect. There's no need to suction the patient based on the provided information. Okay. All right, so that's it for today. I know that was a lot. I tried to go through as quick as I could and cover everything that I wanted to cover on these test questions. See you on the next one. All right. Have a great day.